We are seeing more cases now. And I think finally this virus has kind of arrived at our community. We're seeing more cases coming out of our URI clinic testing. The percentage of positives we have is starting to drift up. Before it was always running only 3 to 4% of all the tests we ran, were positive. Now it's starting to edge up towards 5% or 6%. And we're seeing some people in the hospital now too. So the big question is about opening up and what do we do? Those aren't easy questions, and they're not always medical questions. It's a balance between, how do we take care of people in our community that are at risk? And then also, how do we take care of people that are suffering from the effects of quarantine? I think my best advice is that if we can do things, slowly, incrementally, carefully, and see what happens, So for 2 weeks, we open things up and we see, these businesses are open, these things are, more available. What happens to our number of cases? And as long as we're not, kind of re-accelerating, into a situation of moving beyond our capacity, then you take the next step and the next step. And I think, my bias is towards more care because, as a healthcare professional, I'm seeing people that are very ill from this virus. So we just need to balance that all out, and that's an ongoing conversation in our community and obviously in the broader community as well. So, the healthcare team is still here. We're still ready. We're more ready now than we were even a couple months ago in terms of the gear and the testing, and we're getting some clarity on, our treatment approach, even though most of the treatments are still experimental. And, I think if people get sick, the teams are here and the nurses are doing a great job. The whole hospital team is doing a great job. And I can't say enough about our, the respiratory clinics. And this is throughout the country, but especially here in Ames and Marshalltown and out in Carroll, all those people have really, really stepped up, and just really thank them for that. So, we're all in it together, and just gotta keep taking it day by day.